Welcome to this episode of our health channel. In this video, we'll focus on how middle-aged and older adults can maintain the range of motion for the 8 major joints of the human body, along with expert-suggested exercises to maintain healthy joint ranges. These recommendations come from research reports by well-known medical and government institutions that we shall tell you the normal ranges of joint motion, so you can refer to and compare your own situation. Please click the subscribe button to stay updated on more health-related videos in the future. The range of motion, ROM, of the body's joints is critical to maintaining overall health and functional independence, especially in older age groups. Limitation of joint motion may result in discomfort, pain, and limited functional ability. Mobility is an indispensable part of maintaining health and also one of the 5 important pillars of EGA fitness training system for the middle-aged and elderly. According to American Geriatrics Society, AGS, as people age, various physiological changes occur in the musculoskeletal system, leading to a decrease in ROM. This can result from factors such as cartilage degeneration, muscle atrophy, and decreased synovial fluid production. Maintaining joint ROM is essential for middle-aged and older adults to prevent injuries, improve balance, and promote functional independence. According to exercise and medical experts, normal healthy middle-aged and older individuals should perform joint mobility exercises at least 3 times per week. During each session, repeat each joint exercise 10 to 15 times if they are repeating exercises. For stretching exercises, each should last about 30 seconds to ensure proper stretching. Rest for 10 to 30 seconds between exercises to allow muscles to recover. The total time spent on joint mobility exercises should be kept within 20 to 30 minutes. This frequency and duration of exercise are highly beneficial for maintaining joint mobility and health. The most important thing is to be persistent and do them regularly if there are no uncomfortable feelings. 1. Knee joint. The knee joint is crucial for walking and bears most of the body's weight. According to a report by the National Institute of Arthritis and Musculoskeletal Skin Diseases, NIAMS, in 2020, about 54.4 million U.S. adults suffer from knee pain, and 50% of adults aged 65 and above experience knee pain. In terms of joint range, women generally have a slightly higher joint range of motion than men. According to the report of the Centers for Disease Control and Prevention, CDC, in the United States, the general flexion angle of the knee joint of middle-aged and elderly people is about 135 degrees. To maintain mobility and flexibility in the knee joint, try stepping exercises. Facing a sturdy step or bench, step onto the step with one foot and lift yourself up hard with your heel. Lower your body back to the starting position, then switch legs. Do 10 to 15 reps on each leg. 2. Hip joint. Maintaining hip joint mobility can help reduce osteoarthritis pain and improve the quality of life. According to CDC, hip osteoarthritis affects 9.2% of adults aged 45 and above. The hip joint is essential for daily activities such as walking and bending. The general flexion angle of the hip joint in middle-aged and elderly people is about 128 degrees and about 15 degrees for extension. Exercises that maintain hip mobility and flexibility include hip flexor extensions, leg swings, and clam shells. Leg swings are very effective at maintaining hip mobility. Stand next to a wall or chair for support. Rock one leg back and forth in a controlled manner, gradually increasing the range of motion. Do 10 to 15 reps on each leg. 3. Shoulder joint. The shoulder joint has a wide range of motion and is essential for activities such as lifting and stretching. According to a 2016 report in the Journal of Bone and Joint Surgery, approximately 30% of community residents aged between 60 to 69 experience shoulder pain. The average flexion range of the shoulder joint of middle-aged and elderly people is about 166 degrees. To maintain shoulder mobility, we can perform shoulder rolls, pendulum movements, and wall slides. The shoulder roll exercise helps maintain shoulder mobility. Stand with your arms hanging down naturally. Draw circles with forward, up, back, down movements as wide as possible. Do 10 reps in each direction. 4. Ankle joint. The ankle joint is crucial for stability and balance. A 2020 report by the American Academy of Orthopedic Surgeons, AAOS, shows an increasing trend of elderly people seeking medical attention for ankle sprains. The average dorsiflexion of the foot, upward, is 12 degrees, and the average plantar flexion, downward, is about 52 degrees. Exercises that maintain ankle mobility and flexibility include ankle spins, calf raises, and toe-to-heel walks. Ankle circles help maintain ankle mobility. Stand with weight on one leg, slowly rotate the ankle of the other leg, drawing as big a circle as possible. Do clockwise and counterclockwise 10 to 15 times and repeat with other leg. 5. Wrist joint. The wrist joint is essential for daily activities such as gripping and typing. The Journal of Hand Surgery found that 25% of adults aged 50 to 59 years experienced wrist pain, and the prevalence of wrist pain in the general population is 3.5%. The average flexion angle of the wrist joint of middle-aged and elderly is 78 degrees, and extension is about 70 degrees. To maintain the mobility and flexibility of the wrist joint, you can perform wrist flexion and extension, wrist rotation, and grip strength exercises. 6. Elbow joint. The elbow joint is essential for activities such as lifting and bending. The American Journal of Epidemiology reports that 7.3% of adults aged 60 and above experienced elbow pain. The average flexion angle of the elbow joint in middle-aged and elderly people is 145 degrees, and the extension is about 2 degrees. Exercises that maintain elbow mobility and flexibility include biceps curls, triceps extensions, and elbow rotations. The bicep curl is a simple but effective exercise for maintaining elbow mobility. Holding a lightweight dumbbell, stand or sit with your feet shoulder-width apart and your arms hanging down naturally. Bend your elbows and bring the dumbbells toward your shoulders, keeping your upper arms still. Slowly lower the dumbbells back to the starting position. Do 10 to 15 times. 7. Cervical spine, neck, joint. The cervical spine is crucial for neck movement and maintaining good posture. According to a report by the International Headache Society, IHS, cervical spine disorders are a common cause of headaches, affecting approximately 12% of adults worldwide. The National Institutes of Health, NIH, found that 50% of adults aged 65 and above experienced neck pain. Exercises to maintain cervical spine mobility and flexibility include gentle neck stretches, head tilts, and neck rotations. Neck tilting exercises help maintain neck joint mobility. Sitting or standing upright, slowly tilt your head to one side, bringing your ear closer to your shoulder. Hold the stretch for 15 to 30 seconds, then return to the starting position. Repeat on the other side. 8. Lumbar spine, lower back, joint. The lumbar spine is crucial for maintaining good posture and stability. The American College of Physicians, ACP, found that 80% of adults aged 70 and above experienced lower back pain. A 2019 report by the American Pain Society found that lower back pain is the most common type of pain globally, affecting approximately 80% of adults. Exercises to maintain lumbar spine mobility and flexibility include pelvic tilts, cat-cow stretches, and bird dog exercises. Regularly performing joint exercises not only helps maintain joint mobility but also reduces joint pain and discomfort, improving quality of life and the ability to live independently. These exercises can also prevent injuries, enhance balance and stability, and reduce the risk of developing joint diseases such as arthritis. Remember, consulting your doctor or a professional physical therapist before starting a new exercise program is essential, especially if you have chronic pain or movement limitations. They can provide appropriate advice and guidance based on your specific situation. The EGA Fitness System is a science-based, holistic fitness training system for the middle-aged and above, emphasizing and balancing on the 5 key elements of strength, stamina, mobility, agility, and posture, designed with a personalized approach and catering for the individual's conditions and goals. Please subscribe to our channel so that you do not miss useful fitness and longevity videos. Thank you and see you again.